Here's Dr. John Bergman explaining statin drugs and its effect on your overall health. We're going to keep it into a 3-4 minutes video clip. Please listen.
It blocks a crucial enzyme in the liver, okay? That also makes coenzyme Q. So this means that statins are linked to heart problems. I know there's over 900 studies that show that statins are dangerous. But when we look at the data, okay, we're talking the Journal of the American Medical Association, and I'm sorry about the wordiness of this, but when you look at it, each word is so valuable, and it's a pain in the butt to read each one. But by God, I want you to have the actual data that your doctor should have, but because he's ignorant and lazy, he doesn't have it. If he had the gumption to actually look at the data, people would be saved. So when we look at this connection between statin drugs and the development of various cancers, not just prostate, long-term clinical trials and careful post-marketing surveillance during the next several decades are needed to determine whether cholesterol-lowering drugs cause cancer in humans. That was 1996. In the meantime, the results of the experiments in animals and humans suggest that lipid-lowering treatments, especially with the fibrates and statins, should be avoided. That was in 1996.
30 years ago.
Evidently, nobody read this one. There are currently no evidence that a statin medication which reduces levels of low-density lipoprotein cholesterol improves clinical outcomes such as myocardial infarction or death. So what it's designed to do is prevent heart attacks and death, and there's no evidence that it does, but we do know that it's linked to cancers. Now, why? Cholesterol is the precursor. It's the building block to every hormone you make. We're talking testosterone, estrogen, progesterone, cortisol, adrenaline. I mean, everything. This is the building block for every glucocorticosteroid, mineralocorticosteroid, and sex hormone. This is the most vital component ever. Now, let's say you take a cholesterol-lowering drug. Now, the testes produced testosterone, but also the adrenal glands do. Let's say you're taking a cholesterol-lowering drug. So what happens if you have low testosterone? Now, testosterone, it's a hormone, communication between organs and tissues. Testosterone is responsible for regulation of the prostate. Wow. So maybe if you take it, so it wouldn't be good. So 1 in 4 Americans taking a drug that can negatively affect the prostate of 1 in 6 Americans. Males, sorry. Yeah, then we'll give them Viagra too. You're such a marketer. Okay. Okay, sperm development. Have you seen the fertility clinics in our society? I mean, in the 60s, they were talking about, good God, please don't get the girls pregnant. Now it's like, how do you do it? Okay, cognitive and physical energy, regulation, tissue healing, bone healing, cardiovascular health. I mean, when we're talking about low levels of testosterone, diabetes, obesity, cardiovascular disease, Alzheimer's, stroke, heart attacks, depression, sleep disorders, reduced sex drive, erectile dysfunction. I mean, it's crazy. If you have normal testosterone or above testosterone, what do you got? You got increased mental activity, sexual vitality, improved immune system, lower blood pressure, decreased heart attack, obesity, body mass, diabetes, bone mass. I mean, decreased risk of dementia. And this is all the Journal of Neurology and the Journal of American Medical Association. So healthy levels of testosterone are good. I mean, not from a testosterone supplement. Because if you take a testosterone supplement, there's FDA warnings on it. Neither the benefits nor the safety of testosterone have been established for low testosterone due to aging. The FDA required that testosterone pharmaceutical labeling warn increased heart attack risk and stroke. So when you look at this, I want you to own the structure, own the location of this, and how a sedentary lifestyle is actually going to weaken those muscles. How poor stool formation. I mean, when we get a patient in, we say, well, how many bowel movements a day? A day, doc? God, I'm lucky to crap one every other day. Okay? Is that common? Do we hear that all the time? Yeah, and so if you have poor stool formation, it should be about 3 times a day. That should be working, okay? Heat, when we're talking about moist heat right on that area, right between the rectum and the base of the penis, moist heat penetrates about 2 inches. It's going to help blood supply to it. when we talk about, and these are the causes of it: nervous system, prescription drugs, immune system disordered, injury to the prostate. Have you seen the wedgie bikes or bicycles? Do you think that's going to put pressure on the structures in that area? Absolutely. And when we're talking pelvic trauma, dehydration, stress. So the solutions for a healthy prostate are simpler than you could possibly imagine. Literally get the nervous system checked, exercise regularly, strengthen the immune system, drink plenty of water. And that's what the frustrating thing, because when you have prostatitis or benign prostatic hypertrophy, you don't want to drink a lot of water because it's a pain to urinate.